you've had your baby, so we're done with you. We'll see you when we see you kind of attitude. And I think it's really sad that we've become so dismissive of moms and their concerns in society. And that's not to say that everyone will have postpartum issues, but there are a
Right.
fair amount of women that do.
So I am Dr. Jacquet of Little Ants Physical Therapy here in Connecticut, and I'm here with my mentor, my friend, and my colleague, Dr. Juan Martin. I have to say all those things because that's what you technically are to me. And we
Aw.
are both public health physical therapists, and she signed the light on me of this paving this way to this area in this field. So I want to turn it over to you, Juan, so you can tell us more about yourself and also what we're going to talk about today because we have some other interests. I was surprised after talking to you more and more. We had some similar interests in sports
Mm-hmm.
and areas in PT, not only public health, peds
Yeah.
too. So that's how we connected, guys, so that you know that. So take it away. Juan, tell us about yourself.
So thank you for having me. I just tell everybody you're my sister. Um, Especially since I found out that we lived in the same community, technically in New York. I'm
That's
like,
right.
you were there? Like on the same block? Like down the street? Like we could have been like, we were like totally neighbors. Um, so I'm Dr. Joanne Michelle Martin. I am a pelvic floor physical therapist. I am located in Atlanta, relocated from New York, originally from Barbados. A lot going on. I work with a mixed multitude. I have a background in orthopedics and pediatrics. I played volleyball at the national team level for about 8 years, going from the junior national team and transitioning to the women's national team. So I've always had a passion for working with athletes, working in sports. Did a multitude of sports. As a kid, I started when I was 7. I ran track. Um, I still have a love for track. I just can't shake it. And so now I'm
See, there's
trying to like,
more and more.
right, I'm like trying to quietly ease my kids in there because when I got to college, I had to make the choice. I had offers for
Mm-hmm.
both, and it was like, you want to go to school and run track? Do you want to go to school and play volleyball? I'm like, okay, I'll play volleyball. But now I'm like, you guys are going to run track. I'm not going to push you, but And so I've always loved sports. Got into CrossFit, dabbled in martial arts, and then started. I did Muay Thai. I did a little bit of Krav Maga, and really, really enjoy martial arts. It's the health benefits, all that stuff. But I love the history. I'm a big history buff, so I really enjoy the history and then talking to people. I've had friends who served in the Israeli armed forces, so I got to talk to them about Krav and their experience and just the culture surrounding it.
Right.
And then my kids, they were old enough to start doing karate, and I was like, yeah, let's do that. But I'm kind of not one of those do as I say, not as I do type people, so I decided to take it with them. so we so we're doing Okinawan style karate, and I love it. I absolutely love it. I love the history behind it. I love the melding of the Japanese and Chinese cultures in it. And so, that for me is like huge. And I love that my kids love it. So it's been great for us. Like I said, I see a mixed multitude. I see kids, men, women with pelvic health conditions and some orthopedic conditions still. I can't get away from my roots. So that's kind of where I'm at. And yeah, whatever else, you guys want to know, I'm an open book.
How did you get involved in pelvic health?
My story is kind of very roundabout. I think that, like I said, coming out of PT school, it was all right. I'm just going into sports. I'm going into orthopedics. A little bit of background. I was an athletic trainer. I was a graduate assistant athletic trainer throughout grad school. So as I was in PT school, worked in the athletic training department. And I worked primarily with about 6 athletic teams. I was primarily responsible for volleyball, softball, and women's basketball. But I also work with the lacrosse teams, the soccer teams, occasionally baseball, those types, and cross country. So I would still see a lot of other teams, but then I had my primaries. And it was great. It was really, really awesome. Um, what that did for me though is help me to recognize, and granted I was in PT school, I was like, this traveling thing sucks. Like, does. And I mean, it was like, you get so excited about it. And I was like, oh my God, this is such a drag. Because you would go to a tournament with one team and then you come back and maybe you had a down day or maybe you didn't because I still had class. And then I've got somebody's practice or I've got somebody's game, or maybe, we got two tournaments, at opposite ends of the week.
Mm-hmm.
And so it was just, I'm like, man, I don't know if like, maybe initially it might be okay. So then I started looking into just, what else can I do still in this arena? I worked for an outpatient ortho practice in Manhattan. And while I was there, I used to get a lot of pregnant women. It's like they used to shuttle all the pregnant women to me. So I saw the pregnant women, I saw the postpartum women, and I really loved that population. Granted, a lot of them were very active. We were 2 blocks away from Central Park. So we were in a very, very active community. And then it just kind of continued from there. When I moved to Georgia, one of the places that I worked in a practice that had a pelvic therapist. So I would see a lot of pregnant women and women with a lot of chronic back and hip pain and, more so the orthopedic side of pelvic health.
Okay.
And then there was one point in time, a trauma surgeon whose office was next to us. So we saw a lot of motor vehicle accidents. So now I got to see traumatic pelvic injuries and not just birth trauma, right? And that certainly is traumatic, but we're talking vehicular crashes, high-speed vehicular crashes, slip and falls, all these different things. And that adds another dynamic, right? And so and the love continued to grow. It just continued to grow. And I kept studying and I kept kind of doing the work and taking the classes. And then I had my own kids. And, fortunately for me, I already knew, I was already in the field. But what stood out was the fact that I got no education, no information. And I'm like, okay, I know what's going on. I know after I've had my baby, I'm like, ooh, wait a minute. I just coughed. I felt like I leaked a little bit. Let's go address that. And I was already kind of doing exercises and starting, my rehab, but none of those things were mentioned to me. And it was like, so if this is me who's already aware and well versed in this, and you're not giving me anything, what is happening to the women that don't have a clue? And so that really was that was 7 years ago. And that was really what stirred up the fire in me to do more in pelvic health. So then I was working after my daughter was born. Outpatient was definitely not where I wanted to be because of the scheduling. I wanted more time with my daughter. I was already doing some work at the hospital, one of the local hospitals. So I kind of stayed there, worked weekends, and I was fortunate enough because of my experience to work NICU, mother, baby, and labor and delivery. Whoop, whoop. Got all the cool people.
Bridget.
Got all the cool people, right? Plus that was my hideaway in the hospital. People like, y'all need me to do what? Okay, I'll be back. And then they can find me because I was with my people. Go hang out in the NICU with the babies. So right. But it's so interesting because even in the hospital, you would think that they would know, nursing staff would know. But again, a lot of their background is not looking at the musculoskeletal system. It's not looking at the neurological system. They're there to get babies out and keep people alive. That's it. And beyond that, nothing. So I would have women on bed rest. And I'm like, well, we can't have you just laying here. We're looking at what are their privileges? Can they get up? Can they move around? Is there anything that they can do? Now, there were some people on strict bed rest. But then for the ones that had, and even with them, there was still stuff that we could do, supervised. And I would do that and I would follow them while they were in the hospital. My mom's after cesarean section in the hospital, it got to a point where I was like, I just need to see these people. Don't ask me any questions. Just when you cut them, call me. Just like cut and call.
That's a good idea. I'm going to write that one down.
Cut and call. Because it was like, because then the thing is that when they get out, there's no other information that they're getting. The focus completely shifts. it's no longer what's going on with mom. The focus and the dynamic completely shifts now to the baby and what's going on with them. And I just had a conversation recently. I was talking to some other colleagues, and I was talking to some birth workers, and you know, postpartum eclampsia is not something that we talk about. For example, everybody's like preeclampsia, 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 and then we have this mom who is not being followed. Most moms, if they have a vaginal delivery, are out of the hospital within 24 hours. Well, probably more like 28, because at 24 hours they do the metabolic testing for the baby, and once those results come in, then you're out.
Yep.
So they're not staying there beyond a day and a half, staying there one night really, and then they're out, and they're not being seen again until 6 weeks, and then they're not being seen again until a year. And so when we look at that, and we look at the fact that after we've had this baby, there are a lot of things that can happen, because your body has gone from, creating this baby for 10 months, so 40 weeks, just about. And then now you have this event, and we just expect, there's this expectation, societal and personal and community sometimes and otherwise, that well, she carried this baby for 10 months. She's fine. She'll figure it out, or whatever. And there's so much that can happen. You're at higher risk of blood clots within that first week. There's a lot that could go on with fluid buildup. That can, a lot of women may experience swelling. They might have issues with headaches, or, shortness of breath, which is, another symptom of the blood clot. Different things like that. And we still want to be, or we still at least should be, monitoring these women, especially in those first 2 weeks, especially. And so we don't get a lot of that. And so then you get women, and oftentimes, it's like, well, call the doctor's nurse line. And you call them, and they're like, well, you're fine. Just take a Tylenol.
It's a general hotline.
If you feel it's serious, just go to the ER. What?
Yeah.
Really? It's like, okay, we're done with you. You've had your baby, so we're done with you. We'll see you when we see you, kind of attitude. And I think it's really sad that we've become so dismissive of moms and their concerns in society. And that's not to say that everyone will have postpartum issues, but there are a fair amount of women that do. And, and then when we look at things like maternal mortality rates, we're not only looking at death during birth, but we're looking at any deaths that occur within that first year after birth. They will be lumped into maternal mortality. So, the women that have the headache that just wouldn't go away, and then all of a sudden she just doesn't wake up from sleeping, could it have been prevented? Absolutely. So, I think all that to say, getting into that, I became very passionate about working with this population, and just kind of also advocating and educating, because it's very necessary. It's very, very necessary. Along the way too, again, because like I said, I worked next to a trauma surgeon. Chronic pelvic pain is my thing. I love it. It's just, I love the puzzle. I love the, I'm coming into you, and then they give you the word vomit of all these things that are wrong with them. And it's like, cool, let's figure out where we start. And, we start kind of piecing together the story, which is, for me, it's really fun. I'm probably nuts, and people are probably going like, she's crazy. Takes a little bit of crazy to deal with these things, but just kind of piecing it together and seeing what they need, and just getting them on a path. And I think that that's super important as well.
Right. It's listening to the whole story, not just you got pregnant, you had baby was delivered, and now there you go. It's really talk to you about women who are athletes as well, or women who are just into sports, and that's their pastime. That's what they use to release their stress. And then all of a sudden, the first thing that you feel is dribbles down your pants. Like, I know, I train capoeira, and it's Afro-Brazilian martial art. And there's a lot of movement that goes with that particular art. It's very dynamic. You're either high and jumping, and you're low to the floor and just doing a lot of transitional movements. But for the postpartum female, I can't say I actually had anyone I could talk to about this. It was on the hush hush. It was something that seemed like it normally happened with pregnancy, but you didn't know when it was going to stop or whether or not it was really going to stop. So I'd love for us to dive into what stress urinary incontinence is, because it can happen during pregnancy, and it can happen if you're not pregnant, right? And it can happen to, the youngest to the oldest. So let's dive into that. Can you explain for us here what is stress urinary incontinence?
So stress urinary incontinence is any leaking, any involuntary leaking that happens when a stress has been placed on the body. Namely, you've done some activity or, something has happened. So you cough, when you cough, there's increased abdominal pressure. So there's stress in the abdomen, stress, so to speak, in the abdomen and the pelvic cavity. If you sneeze, same thing, especially if it's one of those big sneezes, like the ones that are brewing, when your nose starts burning and tickling and then like you let it out and you feel like you like let go a whole human after you sneeze, one of those. And, so if you've coughed, sneezed, laughed, if you have tried to stand up from a chair, if you are jumping, any type of impact, all of these activities, one, because of the speed at which they happen, two, because of any impact related to the event, can cause some incontinence. Now, the reason and it doesn't happen just because you have had a baby, because there are plenty of women who have babies and they're not incontinent. There are plenty of women who have not had babies and they are incontinent. And so that's something also to be mindful of. My athletes are usually the ones with stress urinary incontinence. And there are a few reasons why it happens. For one, you've got some weakness at the pelvic floor. Now, this is typically synonymous with that postpartum period, especially if you have had leaking during pregnancy. And so oftentimes you might have had leaking during pregnancy, either because you've gained a lot of weight, you're carrying you just feel like baby's kind of low. You're just, baby's just heavier. It's later in the pregnancy, because you typically won't notice that very early on. Some people can, but most people typically notice it later in second trimester with babies growing more, and then into the third trimester.
Or with a second baby.
Or with a second baby, or multiples, things of that sort. So that's kind of when you notice that as it relates to the pregnancy. And then if you've had this during pregnancy, then chances are you're going to have it in the postpartum, because you've got the weakness, you've got the stretching. The other thing that we've got to look at is when we're talking about size of the belly and amount of weight gain during pregnancy, that directly impacts your posture. And when we're talking about what your posture looks like, we can go from having a spine that is nice and, we think of neutral spine, nice and straight, you're standing tall, versus the kind of very arched low back, where your back is, it's like you're sticking your butt out all the time. And so what that does is it can put some stress on because now the pelvic alignment has changed. So now the way that the muscles respond is going to change, because you've essentially changed their alignment point, their functionality, so to speak. And so that's going to cause some changes. So they might not be able to be as strong, like engage as much as they would have. They may not be able to, you might create some tightness in other places, which then may lend itself to that. And so then you've got these things brewing. So weakness is one of them. The other reason why you would have stress urinary incontinence is because of overtraining. So this is what I see in my athletes, especially those who have not been pregnant. And sometimes the ones who are postpartum that have gone back to training, they're high level athletes. Most everybody is going to think, I need to work my abs, and that's it, right? And then when you're thinking about non-pregnant, or what we would call nulliparous athletes, which are those who have never been pregnant, a lot of them may be doing a lot of abdominal training. The problem with this is that if those abdominal muscles are super tight, then they can impact the pelvic floor. So your six-pack muscles, the rectus abdominis, everybody knows those because of diastasis, but those muscles run from the bottom of your ribs all the way down to your pubic bone. So they actually run into the pelvis. And then you've got the connective tissues that run, the fascia that run with those muscles, the transverse abdominis, goes into the pelvic cavity. So when you're thinking about those muscles, if those muscles are really tight, again, they're going to cause some changes, some shifts based on maybe some tightening up in the tissues and the muscles, maybe some changes in pelvic alignment because of just tightening and guarding and holding all the time. You're also, as a result of it, if you're constantly gripping and holding those muscles, by extension, you're going to start gripping and holding everything around them too, including those pelvic floor muscles. So now those muscles become a bit overworked, overtrained. Oftentimes you can get some pelvic pain also associated with that. But more often than not, because they're gripping all the time. So kind of think of holding your arm up like this, or like this. You can see this arm better. And I'm just holding it here. I'm holding it. I'm holding it. I'm holding it. Eventually I'm going to get tired. And then beyond getting tired, it's going to start to hurt because it's just very uncomfortable just to kind of keep contracting the muscle all the time, and this is not functional. So it's not to say like I'm doing this where I'm actually shortening and lengthening and there's some functionality going on. There's nothing like that. It is, I'm literally just here. And so when you keep doing that to the muscle, it fatigues the muscle. Eventually the muscles get tired or they will start to hurt as well. And so they lose some functionality. And so then when you go to do activity, you may find, especially with high impact activity now, they can't respond as dynamically as they normally would. Then you have leaking. So you'll see this a lot in, let's say, gymnasts. So now they're gripping, they're tightening, they've gone through a workout, and they train sometimes. Like I know little kids who are, anywhere between 8 and 12 years old that train 3 hours a day. They're training 3-4 hours a day, not a week, a day. And so you think of that, and then all the impact from bounding and tumbling and stuff like that. You think of that in your athletes who are lifting really heavy, who are doing a lot of ab work, but not multidimensional ab work. And then they're doing impact like running or jump roping or box jumps or any type of plyometric activity. And then the other thing is you've got some poor coordination going on. So if we're not coordinating the muscles well, if we have poor muscle awareness, which sometimes goes back to that abdominal gripping, if you just have poor awareness, that too can contribute to the leaking that you're having because you're not able to coordinate muscles appropriately in the context of activity. So now let's say we're talking martial arts and you are doing kicks or you are having to do repeated activity. Maybe you can do something for one time, but when that repetition comes in, you can't sustain it, right? Because you're not aware of how to coordinate. And then now when we start changing variables, speed, direction of kick, especially, and I say kicking because most people aren't going to leak with a punch. So if we start thinking now, okay, I can do a front kick just fine. Yay. Woohoo. But now we go do a side kick and you're like, because now you got different muscles working. Now we're challenging those adductors a little bit. Are they tight? Are they coordinated? Are they functioning from where they need to be? How is that pelvic alignment? So now we go do a side kick. Oh my God. Now we go do a roundhouse. Now we got to do repeated roundhouses. Now we got to go through a kata where we may have to do different kicks. Now we got to do a jump kick. And then what happens? And so now you have, you've got this activity that is starting to contribute to the leaking as well.
So now going back, because you touched on a couple of things. You touched on the muscles, you touched on the abdominals, but let's touch on these other muscles that also impact what we call the intra-abdominal pressure that happens when we're performing these exercises, because we're really working against gravity. I feel like in all of them when we're doing these movements as well. As a capoeirista, we're either on our hands doing handstands, cartwheels, and things like that. So the pressures of gravity is one, and also the pressures of what's happening between the abdominals, how the diaphragm. So let's talk about more of the whole connection of all the muscles.
There's a program, a course taught by a pretty well-renowned PT called "If You Can't Breathe, You Can't Function," and it's that course is, I think every pediatric PT has taken the course or in some way has done some form of work with regards to some form of contact with her work. but the beauty of that work is it extends. We kind of don't think of things from like a developmental sequence, and I feel like as a pediatric PT, you and I have a different perspective because we see the continuum.
Right.
If you are not breathing well, you are not going to function well. You're not going to fight well. One of the tenets of any martial arts is your breath, and that is super important. If you're not breathing well, there's going to be some disruption in coordination of the muscles as they move, because there's a lot that happens with your breath. When you breathe in, your diaphragm, kind of think of a plunger of a syringe. So if I had a syringe and I kind of pull the plunger down, then air can go in. And so when I breathe in, my diaphragm comes down and it creates a vacuum, and all this air comes through my nose or my mouth if I'm a mouth breather. But all this air comes into my lungs. But now my diaphragm has done this. Well, everything else has to do something. It has to respond. So, as it pushes your abdominal contents down, it causes a little bit of pressure onto your pelvic floor, and your pelvic floor naturally will give to accommodate it. And as you breathe out and the diaphragm recoils and the abdominal contents move back up, then the pelvic floor moves back up. So it's like every breath, inhale, exhale, inhale, exhale, inhale. And it's very subtle movement, but it's automatic. It's an automatic movement that's happening. When we have weakness in any of those muscle groups. So you kind of think of the soda can analogy, which we use all the time, the diaphragm at the top, the pelvic floor at the bottom, and the lumbar muscles, the multifidus and the abdominal muscles kind of go around, right? And they're kind of securing it. If we've got weakness to that can, let's say there's when it's sealed, there's a lot of good pressure. Everything is functioning the way it should to keep the contents where they need to be, whatnot. If we puncture the top of that can, so we now the top is the diaphragm. So we're affecting breathing. Let's use that analogy as something that affects our breathing. We're not breathing properly, whatever. It can affect the rest of the group. If we have weakness to the pelvic floor, it can affect the rest of the group. If we have weakness in the abdominal muscles like a diastasis, it can affect the rest of the group, because what we're dealing with is a pressure system, right? And stuff is always going to go to the point of least resistance. So that's then where you end up getting, if you've got a diastasis, you get that doming and bulging, because your body's naturally going to compensate by sending all the pressure to the point of least resistance if we don't have a nice sealed compartment. Same thing with the pelvic floor. After birth, we've got some weakness. Any pressure, if we're not managing, if the muscles are not strong enough to counter any of the pressure that we have from throwing a strong punch, from throwing a strong kick, or from the movement that comes with all the other muscles coming into play when we do a big kick. For example, a roundhouse. A roundhouse is a combination of movement. You got to turn, you have to stabilize, you have to turn, you have to kick, and that you got to flex your hip. You've got all these different things going on, and it's a powerful kick. So it's not like, it's not like that. It's power. And when you think of what's happening, your pelvis has to stabilize. It's stabilizing on one side, but then it has to be dynamic on the other side. And in addition to that, it's not only stabilizing so that your leg can move, but now your pelvis is also an anchor point for your hip muscles. Your glutes have to fire on one side, it's stabilizing. Your hip flexors, your quad muscles have to fire on the other side. Then you've got that rotational component. You've got a heck of a lot going on. If those muscles aren't strong enough to sustain that movement, then we're going to have a problem. Something has got to give. And usually what happens, because we're trying to breathe as a source of that power, there's going to be a release somewhere. And the weakest thing, if the pelvic floor is the weakest link, then that's what's going to go. And that's where we see that leaking of urine or whatever have you. If we're doing repeated activity, like running, this is where you see a lot of moms start to complain, I can't run. When I run, I start to leak. Or, and it could be leaking of feces. It could be, let's say they had that's where we start to get into the nuances. If you've had a perineal tear, if you've had perineal trauma, you had a big baby and you ripped from hole to hole. Now you've got all this tissue trauma. This tissue is very weak, and it's not going to be healed in that magical 6-week checkup, right? You got to consider that everyone heals differently. And then depending on their birthing experience, then they're going to have different things to consider. And so, that in and of itself can be a very big factor in the symptoms that they experience.